Good evening and welcome. I'm Mayor Donnie Tuck, and this is another COVID-19 update. Traditionally, we come to you on Thursday evenings, but because of what's transpired over the past few days with respect to COVID-19 cases in Hampton, we thought we would come to you on a Tuesday night to let you know, first of all, what the numbers are, our concern, what our plans are moving forward, as well as to, tell you what we believe you can do to help stop the spread and help us reduce the numbers. With us this evening are our City Manager, Mary Bunting, our Communications Strategist for the City of Hampton, Robin McCormick, and our special guest, Nancy Lima, who's the Epidemiologist with the Hampton Peninsula Health District. One of the things that is particularly alarming is the fact that we now have a positivity rate of over 25%. That is the highest in the Hampton Roads region and the second highest in the state. And we'll also talk about that and put that in perspective. But I want to point out that when we came to you on our last COVID-19 update, which was November 19th, we talked about the number of cases was 2,481. There were 109 hospitalizations and 34 deaths. On today's website for the Virginia Department of Health, Hampton is listed as having 5,280 cases, 4,313 of which are confirmed. There are 209 hospitalizations and 48 confirmed COVID-19 deaths. And so the other thing that is concerned is our moving average back at that time on November 19th, our 7-day average number of cases was 22. My understanding today is that number is over 80. And so again, that is a concern. And so one of the things I want to do is to now ask Nancy Lima if she can help us put some of these things into perspective with respect to the number of cases, what's causing that trend to continue to go upward, and the moving day average.
Hi, this is Nancy. First of all, the positivity rate, the reason our cases are so high is because people are still continuing to gather. Whether it is large gatherings or small gatherings, people are continuing to get together. Whether it's just for a meal or whether it is for a funeral, a birthday, from the holidays, we're still seeing cases from then. So that is what's causing our rates to go up. That's what's causing your positivity rates to go. If somebody tests positive and they were at an event, the people at the event probably are not going to test positive for at least 5 to 7 days if that person was positive, because we do have that incubation period for disease. It could take up to 14 days of incubation before that person tests positive. So with that positivity rate, that's why ours is so high, because of the number of positive cases we've seen. As well as the moving average, it's because back in November 19th when you had your last thing, we've since had Thanksgiving, we've had Christmas, and we've had New Year's, as well as other people getting together for Hanukkah, other kinds of celebrations. So they have had people that test positive, and then those people have spread it, and then it gets out into the community. And we do have community-wide spread right now.
And I was trying to find my numbers from today online. They have it by age group. But I do know that back in November, the age group that had the most at the time was 20 to 29, and that was 622. And I don't recall the numbers from earlier today. We'll see if we can try and get those. But again, what seems to be the concern, that 20 to 29 age group still seems to be the largest number. Can you perhaps give us an explanation of why that seems to be the case? Because on our region, none of the universities, perhaps with the exception of maybe William and Mary, are having in-person classes. So if I'm thinking about 20 to 29, I'm thinking about maybe college-age students, maybe a little bit older. Do you have an explanation of why that number seems to be so high?
Well, that number is our younger working class. Those people are going to work every day. They are out there in our community, as well as on their way to work, they're stopping at the grocery store, they're stopping at the convenience store, they're going into fast food restaurants. They are out in our community getting around, as well as they are doing activities. They are going out, they're still having get-togethers where they're having parties and things like that. Those things have not stopped. Most of our colleges, like you said, are not in, so that's not attributing to a lot of that age group. We may see it if they do come back, but right now it is your young working class that's out there and are still getting out every single day. They are not at home.
I'm going to ask our city manager, Bunning, if she will tell us maybe what your concerns are as the city manager, workforce, as well as what are the implications citywide.
So certainly, I want to echo what Ms. Lemis said and the mayor has said about the alarming rate, the positivity rate. And first off, want to encourage all of our residents to do their part and to continue to really govern your actions as much as possible. We realize people do have to go to work and we do have to get groceries and things like that. But just as at the outset of this pandemic, we need to be minimizing our social gatherings and our discretionary activities. And so I certainly want to convey that message. I think we all need to sort of do our part. At over 25% positivity, we're actually worse than we were at the start of this right now. And so we really all need to do our part. Now, in terms of what the city can do as doing our part, we really want to protect our workforce so they can continue to be there for you. Whether it's our first responders that you typically think of, like our fire and police officers, or we're talking about other first responders, social workers, 911 workers, our public works folks. We need to do our best to be able to telework as many people as we can. Many of the professions I just mentioned can't telework, but we need to minimize the number of citizens coming into those offices and potentially spreading their exposures to our workforce. So today we announced that starting tomorrow, we're going to move to an appointment-only system for most of our city services. So for instance, if you're someone who needs to file a report or get a record from HPD, we're going to ask you to try to do that telephonically, through our electronic means. And if you really need to come down to HPD, we're going to ask you to make an appointment. Similarly, if you need to get a city permit, we've made provisions so all of this can be done electronically. But if for some reason you need to interact with city staff and it can't be done telephonically, we're glad to have you come in and visit with you, but we're going to ask you to make an appointment. By doing this, I can telework more people, so I have less people in City Hall spaces, and we can also stop a lot of people from coming in and potentially infecting our workforce so that we can keep our workforce healthy and continue to serve you. We also don't want you doing discretionary activities, as I said at the outset, so that we can all do our part. But we do absolutely want to serve you. We will continue to serve you in many ways. One of the sort of positives, I suppose, if you have to look for a silver lining in this pandemic, is we have found more and more ways to serve our residents virtually. And so virtually any city service that you want can be conducted telephonically or electronically. A few other things I'll just mention real quickly. Our public library is going to move back to curbside service. They will offer curbside service by appointment on Monday through Friday, 10 a.m. to 4 p.m., and Saturday, 1 p.m. to 4:30 p.m. All 4 of our library locations now offer Wi-Fi access in their parking lot, by the way. So if some of you are still struggling for Wi-Fi access, we've made provisions to make that easier for our residents. Our golf courses will remain open with tee time reservations so that you can do outdoor recreation. Other city recreational facilities like the community centers have not yet opened, so they will remain closed. I will look forward to talking about other, city services people might have questions about as we go throughout the night. But those are some high-level overviews of what we're trying to do. I will also say we're getting a lot of questions about vaccines and when we will be in certain phases. I do want to make clear that the vaccine operation is not a city government operation. That is a health district operation, and we do plan to have the health district representative who's dealing with the vaccine rollout at a future session to talk with you about where we are in Hampton. All of us, I know our health department partners at the state are working very, very hard to get us into 1B as soon as possible, and the city staff are offering various resources, including locations that may help us move into phases quicker and vaccinate more people faster. Those plans are all underway, and as city manager and as a council mayor, we can't supersede the state health department's direction or their operational plans. But we do look forward to updating you on those when they are ready to share more details with you.
Well, one of the questions for the city manager is that people often want to know, are there shutdowns that are planned? Are we looking at curfews?
So to be clear, you know, the shutdowns that happened early on were governor-initiated shutdowns. Generally speaking, the city government does not have the authority to issue our own lockdowns of businesses or of you know, limit social gatherings or those kinds of things. Those orders come, you know, through the governor with the consultation with the commissioner of health. We do follow those when they're implemented, as we all should follow the statewide orders. What we can do and are doing is to make our own operational decisions about city facilities. And that's why you see us doing the kinds of things I talked about tonight. But we would not be in the position to legally order, you know, different restaurant hours or lockdowns of certain types of businesses. That really does have to come from the state. In a Dillon rule state, which is what Virginia is, those decisions are made at the state level.
We do have some Facebook questions, if that's okay. And I have to say, I'm going to take this off to make sure you can hear me. All of them so far are directed at the health department, and I regret to tell people we cannot tell you exactly when you're going to get your vaccine. That said, we have slide 5, and it is a new quiz the health department put out to give you some clue where you are in the vaccine priority. Nancy, do you have anything to add about that?
Yes. Right now, we are still vaccinating our healthcare personnel, so that they are the people that are actually face-to-face seeing patients who are ill, taking care of our high-risk residents. They're the ones, your EMS, your fire, those are the ones that we are getting to first, because those are the ones at highest risk to be infected on the job or in their daily activities. Then the phases will move, and we, like Ms. Bunting said, we are not, at our local, we have to go by the state regs. So we are going, when the state tells us we can go into the next phase, we will move as quickly as possible and get that done. We are giving them 3 days a week at Peninsula as well as Hampton Health Department right now, and we're going to be adding more sites as the time goes on.
And I think also we have a slide number 6 kind of showing the Virginia Department of Health's website and a vaccine information line for people who have questions that are specific that we can't begin to answer here.
Yes, and that number is 757-594-7496, and they will be able to answer your questions. If they can't, we will send them up and try to get the answers and get back with you.
Right, I think it's 757-594-7496.
7496.
Right on. Let me ask you, we talked earlier about PCR versus the other type of rapid test, and there's another name for it. What are the differences, and which one has maybe the better outcome?
Okay.
Or more reliability?
I'm going to take this off for a second. First of all, there's 2 main tests that we do or can be ordered for COVID. The first test is the antigen test. That is your rapid test. If you go to your urgent care or your doctor's office, they have machines that can do your test right away. They are doing still a nasal swab, but they can tell the results right away, and you don't have to wait. It doesn't have to go off to a lab to be tested. That is a rapid test. The PCR test, which is a nucleic acid test, it is a test that usually the labs have to send off. It usually takes a day or 2 to get the results, and then that is a confirmation test. So that is the one that if it tests positive, you definitely for sure have COVID. Antigen testing, sometimes you can have some things that cause you to have a false positive, but if you are symptomatic, and your antigen test is negative, they will probably follow it up with a PCR because they want to make sure that you are being diagnosed with COVID if that is what you have. So that is is your confirmation test. The rapid test can just be done quickly and give us a quick answer. If you are symptomatic, your doctor can diagnose you just by your symptoms. But because we're having flu out there right now too, we would want to make sure which it is. So most of them are doing the COVID testing.
Let me ask you, and I'll probably go back to Facebook for another question, but as an epidemiologist, you study trends
Yes.
somewhat. Okay. So I'm looking at, again, our November 19th data. There's cases by race and ethnicity. Blacks, 1,161. Latinos, 103. White, 466. Today, the data I got online, Black, 2,299. Latino, 220. White, 1,231. What does that, those numbers suggest?
Well, the trends could be that we still have inequities in our communities. We still are trying to get testing done in the places where some people don't have access to health care or good access to health care, but they still are increasing. We are seeing people who do not have the access to care testing positive because they are in multi-generational homes. They are with people who are positive and don't realize they're positive. We have a lot of people who are asymptomatic, who don't have any symptoms at all, who are contagious for 10 days, because when you are infected with COVID, you are contagious for 10 days. So these people are still in the households. They don't realize it. They may not have access to care to get tested or have a place to get tested, because most of our facilities now, to get tested for COVID, you have to make an appointment. So you have to, if you're asymptomatic, they're worried about missing their job. Their employer may not want to pay them if they're out, so they're not going if they're just mildly ill, so they're continuing to work. So those are some of the problems that we have seen all along, but more so now since there is a surge in disease.
I had a conversation on, I think it was Sunday evening, with actually the relatives of a Hampton resident. Her husband had spent 3 weeks in the hospital with COVID and was unable to walk. Now he is having to go through physical therapy to learn how to walk again. He's limping, he's on a cane. She spent 8 days in the hospital. And yet I hear about the congresswoman from New Jersey today who has COVID or test positive for it. So what dictates or determines, what, I guess, how badly you have it?
There is no way to tell that, unfortunately. We feel like our people who have comorbidities, whether it's high blood pressure, whether it's cardiac, whether they're diabetic, whether they have cancer, whether they're older, those people are more likely, because of science that we've seen, are more likely to test positive, to have more severe symptoms. But we've also seen young, healthy individuals end up in the hospital. Me, for example, my daughter has no comorbidities, no problems, and she was in the hospital, not in Virginia, but she was in the hospital for 6 days with COVID, very severely ill. So it has been, we can't tell one way or the other, where if you get infected because I'm healthy, I'm not going to end up in the hospital. There is no way to tell that. And that's why everybody needs to do their part and be very, very careful. And right now, with the surge of disease that we have, everybody may not get that call from the health department to get interviewed, to get the contact tracing. So we need you, if you test positive, you need to let your contacts know. A contact is a person who is within your 6 feet space. Even if they have a mask on, they're in your 6 feet space 15 minutes over 24 hours. They are considered a contact. Those people need to quarantine and stay home because they may get disease within 14 days.
Nancy, we're hearing the term community spread a lot. Does that have a specific definition, or, what does it really mean?
When we're talking about community spread, it's everywhere. We are not seeing it. We have not, as epidemiologists, we open the cases, we look kind of sort of see where they are. We can't exactly tell in the community where it's not in one place. It's all over the city. It's not in like Buckrow or Phoebus, or it's all, there's positives everywhere. It's not any one place that there's no positives.
And is that kind of where we are now in Hampton?
Yes, yes.
Okay. We do have a question, too, about getting tested. And I know that's a lot of times private facilities, but where can people get tested, or how can they get information about testing?
First of all, testing, there's information on testing on our website, vdh.virginiaspelledout.gov. There's all kinds of information about testing. There's actually a tab that you can go to. Also, for testing, all of your urgent cares, a lot of your private doctor's offices are now testing in their offices. A lot of them are doing the rapid test, which is fine, because then that at least, especially if you were symptomatic, that at least lets you know whether you have COVID. We treat somebody who has that rapid test, if they are symptomatic, we treat them as being COVID positive. They don't have the PCR to confirm it, but as far as us treating them and the way the doctors treat them, they treat them the same as they are positive. So they can get tested, any of the urgent cares, most of your private doctors. Your ERs should, I mean, you can go there, but they should be for people who are really severely ill or really need that extra care.
What do you recommend for people who are asymptomatic? Because a lot of the testing centers are only testing people with symptoms. Is there some recommendation that you have about that?
The recommendations from CDC as well as from VDH are, if you are exposed to somebody, we recommend that you get tested 5 to 7 days after your last exposure, whether you're symptomatic or asymptomatic, because that's the time period in that incubation period you are most likely to test positive.
Right. We're just hearing from people who say they can't get an appointment because the screener at the testing facility wants some symptoms to be able to schedule.
That has changed a little bit recently. We aren't seeing that quite as much, but you are going to have an appointment, and the drugstores are testing also. CVS, Rite Aid, Walgreens, all of them have testing facilities too.
Great.
But I will tell you, they're very hard to get. I went online and looked and was unable to schedule a test within about 4 days.
There is, and I'm not going to say which one, but we do have one of our urgent cares. They're doing same-day appointments. So as long as you call that for early in the morning, a lot of people are getting in.
That's good to know. And phone calls sometimes are,
yes.
It's hard to get people online, but if you do, you might get a better outcome than sitting there on the internet.
Yes.
And always, I think, too, check with your private physician first.
Yes.
If you have a family physician, that's a really good place to start.
Yes, because most of those can do the MP swabs or nasal swabs, because a lot of our tests now, they don't have to do the complete MP swab. A lot of them, they can just do a nasal swab.
What's the first one? I'm sorry, Nancy.
The MP is nasopharyngeal, where it had to go further into the nose cavity, into your nares, where the nasal swab just has to go up to the anterior part.
Oh, that's much more comfortable.
We've been through that.
Yeah.
I got the other one. But I have a question for you. And I get emails sometimes, and individuals are telling me, please don't make mask wearing mandatory. And no, I'm sorry, that was earlier. Now it's don't make the vaccine mandatory.
Right.
Before it was don't make mask wearing mandatory. So I have to believe that we have, we talked about the different groupings and socializing and getting together with family members, but I've got to believe there's something more than that that's causing this trend, this problem. So what are your, I guess, fellow researchers or people in the field or your associates telling you is going on? What's the mindset? Are we just becoming less guarded? We're not sanitizing, wiping things down?
I think, first of all, I think a lot of people everybody has COVID fatigue. Everybody's tired of COVID. They're tired of wearing our masks. They're tired of having to stay in. They want to get out with their friends. They want to mingle with their family members and things like that. A lot of people are going out to dinner, and when you go out to dinner, if you're not spaced like we are, where we're at a safe distance, you're just sitting across the tables from somebody. You take your mask off, you're eating, so that is a possible exposure there. So we have lots of different ways that it can be spread as far as socializing and getting out, and we do still have a lot of people gathering and not wearing masks, which or you'll see them not wearing them properly, where they wear them as a chin strap or an earring or all different kinds of ways. So if you don't wear it covering your mouth and your nose, you're not protecting. And with a mask, you're not protecting yourself. You're protecting the other person. And even if both people have on masks in a social gathering and somebody tests positive and you were within that 6 feet space, like I said, that 15 minutes, you were still considered a close contact and you need to quarantine. The mask doesn't get you out of that. And also another big misnomer that people have is if a friend tests positive, they run to the doctor, get a negative test and say, now I have a negative test, I don't have to worry. That's not true. You can't test negative. You can't test out of quarantine. When you are a close contact, you have to finish that 14 days. You cannot test out of quarantine.
And many times people don't wait long enough for the test to give an accurate result. I know you
Right.
touched on it earlier, but it might be good if you could touch on it again. Let's say you get a call from someone and says, I tested positive. What's the minimum amount of time I need to wait for the viral load to build up in my system to be recognized by the test?
If you are symptomatic, you need to go right away. But if you are not symptomatic, then the best time to get tested is 5 to 7 days from your last exposure. That is the time that the virus is most likely to show up.
We have a couple questions online from healthcare people who don't work within one of the major healthcare systems. They're independent, or one is a healthcare personnel who works from home and is not in a clinical setting. Is that person still in the first 1A, or is that person a little lower, and how would they find out?
They need to call the 594-7496, and they will be able to answer. They're also keeping a list, and we are scheduling people as they are eligible under the phases that we have.
Brower has a question about contact tracing, how you do it, how it's communicated, and maybe how long it takes, especially with this many cases. Are you able to really get to people?
No.
And I'm going to throw in, does the COVID app help?
Yes. What we are, as far as contact tracing, when somebody tests positive, your lab goes into our system, and we open the case, and it goes to our contact investigators. Our contact investigators call the person, we interview them, and we find out who their contacts are. Again, that fit that 6 feet, 15-minute, over 24-hour time period. Then we take those names and we enter them into the state system called Sarah Alert. This system is a system where we can put your name, telephone number, and you have the choice. You can get a text, you can get a phone call, or you can just go on your email and you can check. No, today I'm not having any symptoms, or today I started with the fever. That way we know where you are while you're in your quarantine time, and we can follow up. Unfortunately, with the surge, that's why I said earlier, people need to do your due diligence. You need to let family, friends, coworkers, if you test positive, do not think that you have leprosy or something. You need to be honest and let people know that you tested positive, so they know that they are a contact, so that they can watch themselves and be observant of their own signs and symptoms and their own health, and to let them know they need to get tested.
Have you seen that, Nancy? Because I do feel like in the community there are some people who are embarrassed or feel
Yes.
afraid to admit they have it, and then that just jeopardizes more people down the line.
Yes, a lot of times if somebody tests positive, they're afraid to say, because then people don't understand or not educated. They don't want to, even after they're finished their time, they don't want to be around that person. They're ostracizing them. Remember, if somebody's quarantined, they may need a little help getting their groceries or getting a prescription. You can always leave it on the door. because like when I was in what I called COVID jail when my daughter was sick, because I had just left Charleston when she got ill, I had to stay home, and I lived by myself. I was there. I had to realize how to do groceries and get them delivered to the door, and I ran out of Diet Pepsi, and I was dying because I really wanted some, and had to figure out who I could get to drop it off. So don't, still check on your friends, check on your older neighbors, because they may need some assistance.
Well, we have two people on deck, just in case there's some questions that came that we weren't prepared to answer. But we have our Emergency Operations Director, Weson Walker, and we also have our Chief of Fire and Rescue, Chief Jason Monk. And I'd like to ask Chief Monk if he'd come forward and maybe give us another demonstration of some of the precautions related to how you handle your mask once you've been out and you've touched someone's shopping cart or you've handled packages. We're going to have you come right here.
I think they made the podium for you there.
Okay, yeah. But because I've found myself not necessarily being as cautious as I was early. Now, I still use my hand sanitizer or wipes, but you gave us a very good demonstration of how, once you get back into your vehicle, what's the process, please?
I might be put on the spot, but I've been doing this since February, March. Forgive me for touching my face. Well, one of the first things I want to say is that I see a lot of people that, maybe not as much now as before, that were wearing rubber gloves whenever they drive, wherever they're going, into the store, and then they come out of the store and come into their car and the rubber gloves are still on. That's not a very effective measure of infection control. The routine I go through every day is, as soon as I get out of my vehicle prior to entering a building, I put my mask on, and I leave it on while I'm around other people. As I go by the many kiosks that we have of hand sanitizer, several times throughout the day, I'm forever sanitizing my hands, probably more so than I need to be doing. And then again, putting the mask back on whenever I'm going to be in public spaces. So you can't wash your hands enough. I know a dermatologist may disagree with me, but in this case, I think it's important to do that. But it's also important not to, in fact, this is a new mask, not to wear the same mask day in and day out without washing it as well, because the contaminants come onto the mask. You touch your mask like I'm doing right now, and I'm transferring germs onto the mask. So we should all know by now how to do it. And Ms. Lemis mentioned that we all have COVID fatigue, and that's for certain. And sometimes we let our guard down a little bit, but now's not the time to do that.
Well, Chief, what about precautions when you're transporting patients? We know early on individuals were somewhat hesitant to even go to the hospital because they were concerned about catching something. Well, now you've got your EMS folks who are transporting patients. How do you assure the public that you're transporting them safely if there's a need to be transported to a hospital facility? Well,
our folks are pros at this now. And fortunately, we have the type of equipment we have is the ultimate protection. We use what's called a P100 respirator. And that's what you see the canisters on the side. That's 100% technically effectiveness against the germs. But while our providers are taking these precautions throughout the day prior to running a call, before they come to your home and before they see you, they are making sure they don the proper equipment. They're wearing the mask, they're wearing eye pro or eye protection, they've got their gloves on, and in some cases they're wearing a gown depending on how the patient presents. They maintain distance as much as they can, but you know that this field is hands-on. So we usually have to touch our patients. So we take extra precautions, not only for our sake, but to give peace of mind to the patients that we're treating as well, that we are doing everything we're supposed to be doing to try to keep them safe. And we did see, and you mentioned, we did see in the March, April, May timeframe a reduction in calls, mainly because people did not want to leave their homes. So they were following the guidelines, but what we're also finding is that these patients may have some issues that they need to be seen at the hospital. So we did a Facebook Live and encouraged our citizens to, if you have a problem, call. We will come and we will do so and take care of you safely.
One last thing, and I just thought about it, I think maybe 2 or 3 weeks ago. We touch our keys all the time, and I don't think anybody thinks to, hey, I need to clean my keys or whatever. We just handle things and we put our keys and we get back into a vehicle. Any concern about transmission via keys or just what?
Just washing your hands.
I think just washing your hands, and I certainly don't want to overspeak the fact that we have an epidemiologist here that knows far more than I do about this, but the respiratory droplets are your largest concern here. Of course, when you're talking and you're touching things, you're transmitting that to the surface, and it doesn't live on the surface for that long a period of time. But the air droplets in the air, especially if they're aerosolized, they float and they move with currents. So that's what we're most concerned with. But now that you've mentioned that, I'm going to assure that when I get home tonight, I'm going to spray my keys down.
Thank you, Chief.
Nancy, you earlier talked about access to care and disparity in terms of this, but one of the other issues with the vaccine is that, according to a national survey, only 42% of Black Americans would consider taking the vaccine, compared to 63% of Hispanics and 61% of white adults, and that's due to a long legacy of things that have happened with Black people and the medical community, some pretty terrible. And I'm going to turn this to the mayor too, because I know he's involved in this. How are we communicating to that group of people that this is safe? And first of all, Mayor, do you believe it's safe?
I do believe it's safe, and I was going to possibly address that. I was just trying to decide how much I wanted to talk about, because actually I think it was December 23rd when Dr. William Harvey, president of Hampton University, Dr. Jeffrey Smith, our school superintendent, and I took the first dose of the COVID-19 vaccine. And when Dr. Harvey contacted me, he told me that he had had conversations with our U.S. Surgeon General, and in those conversations, he was told that the percentage of Blacks who were willing to take the vaccine was only around 42%. And again, a lot of that had to do with the feelings, beliefs, the actual studies from the Tuskegee experiment, as well as other medical experiments on Blacks, and that concern about, well, is this some kind of experiment that they're just using me as a guinea pig? And the concern about maybe this vaccine is being rolled out too fast and things like that. So I got my first vaccination on the 23rd of December. I was told actually by the president of Centera Careplex that I would probably my arm would be sore the next day. Actually, it was fine. It was the second day when I actually started feeling some soreness, and I took a leave, and that went away. I got my second vaccination earlier today, and so far no side effects from that. And so I do want to assure individuals that I took the shot not trying to jump ahead of anybody. I was asked by Dr. Harvey, because the sense was that as a Black mayor, that given that only about 42% of Blacks were willing to take the vaccination, we have to try and get a percentage, I believe, some 70% or higher, in order to try and create what's called the herd immunity or community immunity that would allow us to really to have a successful protection against the COVID-19 virus. So that was why it was a matter of trying to show individuals that the vaccine is safe. And so we still find that there are individuals in different groupings. We've heard that even people on the health staffs of hospitals are not necessarily willing. We've got first responders who are in that priority 1A group who are supposed to be getting shots and things like that. And so there is some reluctance, but I've been told and read and heard that this vaccination went through, or this drug went through a number of different types of trials. Same amount of trials and testing that regular vaccines go through. And so there was no rush to try and get this done. Yes, it was done faster than many other times that you deliver a vaccine, but in this instance, it was tested, and it has been found to be 94 to 95% effective. And so the reason I took the test or at the shot was to make sure that I could tell people that it is safe.
Thank you. And Nancy, does the health department have some plans to reach out to some of the communities that don't have as much access to medical care as maybe I have, or access to the internet to schedule things?
Yes, we are. We're going to be like I said at the beginning, right now we're doing our medical personnel and all, but as we get to the other phases, we are going to be opening other sites where we can go to where people may not have the access. We're going to be moving sites later on to different places in our community so that we can meet those needs. And as far as the vaccine goes, the more education people give themselves, the more comfortable they'll be with it. So they need to read the CDC's literature, they need to read the website for us, and really educate themselves and really find out the amount of people who have had side effects or haven't had side effects that, and then, you know, somebody may say they have a side effect, but it may not be considered a severe side effect. So they need to do that education. They need to read up on it themselves and don't listen to just the next door neighbor. They need to educate themselves the best they can so that they can make the decision that's best for them.
And we do have a question from Tyron wanting to know when teachers can get tested. And we are not answering when because we don't know that part.
Don't know.
But there is a process.
There is.
And where are they on the order? Or Mary, you have some information about that, I believe.
Sure, and I see that our tech team has posted the slide that the governor provided. Teachers are in category 1B, and our area, not just Hampton, but the entire peninsula and south side are currently in 1A. I can tell you, again, that this is not a decision the city council or I as city manager make. It's driven by when people in 1A are fully vaccinated, but I am in almost daily, if not daily, contact with our health district to determine how we are progressing through phases and really to make sure we're ready to go to get all of our first responders, like police officers. For instance, our EMS providers have already been vaccinated, but we want to get our police officers. We have social service workers who are going into homes like nursing homes and homes for adult protective service cases. We have, of course, our teachers. And when we talk about K-12 education, we all want its schools open back up. It's not just teachers, it's bus drivers and cafeteria workers and that whole infrastructure to get our kids back in school. So there are a lot of essential workers that are in that 1B category, and we're all very, very anxious to get there. As soon as we are able to get there, we will be cycling people through. I've talked to Dr. Smith every day about making sure that he, for his team, and me, for my team, are ready to go as soon as we get that official okay from VDH to move into 1B. I will say I know that people are a bit frustrated because they're seeing some parts of the state move into 1B already. And that's part of why we're talking with our health district about how we can get there. Some areas of the Commonwealth just frankly have more hospitals, more private providers, others to get that 1A done faster than other parts of the state. And so, we're having conversations with the state about making sure we think about social equity. There are wealthier parts of the Commonwealth that just have more resources than other parts of the country. And so making sure that we're thinking through those issues and really making sure that they're not have and have not localities is certainly something that's going on in the Chief Administrative Officer group and with the health district's directors, concurrence. So long answer, but I just want to make clear people know that it's not like someone's sitting back, holding back vaccine, getting to our critical people. We all want to get to 1B and then 1C and then 2 and 3 as fast as possible.
Go back to something I said earlier, with respect to the emails I received about individuals saying, please don't mandate getting the vaccine. I don't think the city really has the authority to mandate anything as far as how it affects someone personally. But that said, the emails that I'm getting are actually these, they're basically just these emails that you get almost from an email mill that I don't think the individuals who are circulating these have actually taken the time to read them. But I will offer that if you want to get back to a real sense of pre-COVID normalcy, then you've got to try and do something to contain or stop the spread. And the one thing that's been, at least we believe will do that, is the vaccine. And so I know there are individuals who believe that these great conspiracies by the government or big pharma or whoever you want to say is behind it, but you've got to be willing. And same thing with mask wearing. It's not so much for yourself, but we're talking about we live in a community. And as a community, you ought to be concerned about the health, safety, and welfare of those around you. Not just your own personal family members, but those who help make this a community. And so if you're not willing to do it for yourself, at least try and do it for the benefit of the others in the community.
I think
We have a little bit of a lull, so Nancy, what else are you seeing out there working with people? I mean, I assume some of the delays in getting vaccinated is the vaccines and the difficulty handling them, but some of them is literally having enough trained nurses and personnel to actually do the shots, and you can't really take them away from the hospital where they're caring for people, so it's a complex situation.
And we are in the process of getting some other nurses, some trained nurses through agency, through other organizations to come and assist that. We do have some retired nurses, retired physicians that are also be assisting with vaccine clinic, whether it's to give them to help assist with the paperwork part or whatever. So we are using some of our MRC volunteers to do that. But again, we need RNs to actually administer the vaccine. So we don't have as many of those, but we are looking into agencies and things like that to hire some. So.
And I believe there's a partnership with some of the drugstores, the pharmacy
Yes.
chains who are doing nursing homes. Is that
Yes,
right?
yes. They've already started going into some of our nursing homes and vaccinating the workers as well as the residents.
Chief Monk, I think you had an observation.
Yes, sir. So I was hoping I'd have just a brief moment or a chance to break down what this vaccine is in layman's terms to help everybody understand, because what we've found is that when people don't understand, they tend not to trust. And so certainly I'm not standing up here telling everyone this is what they should do, but what I can do is that I can explain the science behind it and dispel some of the rumors about what this vaccine does. So in my personal opinion, this is brilliant science at work, because what it does is, if you imagine a twisted ladder, which is DNA, the scientists, what they did was they broke down the SARS-CoV-2 virus into its individual blocks and found the one block that codes for that spike. If you picture the virus that we've seen all over, there are little spikes all over it. They found how to code for just the spike, which is not the dangerous part. The spike, what it does with the SARS-CoV-2 is once it goes into your body, that's what allows the virus to get into your cells. So the virus uses messenger RNA, and it creates an email to create that spike protein only into your body. So your body recognizes the spike protein, it mounts a defense, which is why you feel some of what you feel in your arm and the muscles, sometimes the fever. That is not you infected with SARS-CoV-2 or having COVID-19. There is no part of SARS-CoV-2 in this vaccine, whether it's Moderna, Pfizer, or the AstraZeneca that's coming out. So what I just wanted to explain to people is, don't be wary of being infected with the virus due to the vaccine. Know that all they are doing is sending an email into your bloodstream to create that spike. So next time, if there's a time that SARS-CoV-2 finds its way into your respiratory tract, your body will recognize that spike protein, mount a defense, and you're fine. It'll break it down before the virus can infect you. So I wanted to share that because I had to do my own research to make sure I was comfortable with it. And I follow some well-known physicians online that have also broken it down, but if you just think of it that way and know that you're not being infected with the virus, it's a vaccine that's just sending a message to your body, that may put your mind at ease. But
Thank you.
And I
Yes.
have one thing similar to that. Also, we've had some people who have gotten their first vaccine and then they have tested positive for COVID. They did not get COVID from the vaccine. They were exposed to COVID prior to getting the vaccine. So remember, it takes that 14-day incubation period, and they went and got the vaccine on, say, yesterday, but they were at dinner with some friends on Friday. They could have been exposed on Friday, got their vaccine, and now are having symptoms. So just because you get a COVID vaccine, it's not going to work right away. It takes 2 weeks to develop those antibodies that Chief Monk talked about. And so it's going to take a little while to take effect. But if you test positive for COVID after getting a vaccine, it's not from the vaccine. The vaccine is not a live virus. It does not put COVID into your body at all.
Well, and so that begs another question, because I know someone who did get COVID about 2 weeks after her first vaccine. One vaccine is not going to fully protect people, right?
You need 2 vaccines. That's what science is telling us. That's what CDC is telling us. You need that second vaccine to boost that immunity so that you have a longer protection. You have longer immunity against that disease. So you need both doses.
And we said earlier, we saw Walker on deck. I don't want to put her on the spot, but I would like to allow her an opportunity to come and maybe tell us what they're doing as far as emergency operations, what she's seeing maybe in Hampton, and maybe again what a strategy might be going forward. Good evening.
Thank you, Mayor. So we are diligently planning for, it's too short. We're diligently planning with the health district and our partners in all our emergency operations, Mayor, and we'll continue to do so. And we take our direction, and as the Mayor, our City Manager Bunting said, from the health department as we continue to plan for operations. And should we have a snowstorm or a hurricane, we have made plans for that to continue our social distancing, proper hygiene, and everything like that. So we do have plans in place to do that.
Thank you.
Thank you, sir.
Yeah, and just to elaborate a little bit on what Weeson Walker just shared, part of this collaboration with the health district is talking about available resources. So as you might imagine, as we get deeper and deeper into the general population and vaccination, we're going to need more locations. So we're working with them on locations where we might be able to offer vaccination clinics and things like that. But again, I don't mean to be repetitive. We can't just open up our own vaccine clinic whenever we want to, but we're making those planning arrangements so that as the state gets sufficient vaccine to finish each phase, we're not delayed because we don't have the physical infrastructure to support what the health department is ready to deploy.
Right. This is a third rail for either the city manager or for Ms. Lima, and this goes to the hospitalizations and the fact that back in the summer, the city or the state was looking at possibly having to have an off-site type of care center. Is that still a consideration, I guess, for convention center? And I guess from Ms. Lima, are we seeing numbers that might suggest in our region that we may need to look at that we're taxing our healthcare centers?
I talked to a lot of our infection preventionists at the hospital almost daily. And so far, our hospitals are handling and are holding their own. We've had a surge, and our numbers are higher than what they were back before Christmas, but the hospitals are still being able to handle it. And our planners, as well as our emergency personnel, they are following that constantly. They get reports of how many people are hospitalized, how many people are needing oxygen and those kind of things, so they are keeping up on that, and as needs arise, it gets escalated up the chain to the state if possible.
And to sort of just answer the mayor's question about the convention center, we had made all the arrangements we needed to, both contractually as well as design of how such a facility would be built out, when it became clear that wasn't necessary. All of that work is done so that if we got to the point where we needed that, we're ready and able to respond. So we've not had a request from the hospital system or from the governor's office to do that, and there are various ways of dealing with small surges versus huge surges. We're hoping that people will see these numbers and take the appropriate action so we don't find ourselves in a place like other parts of the country. I know I referenced it because I watched it quite a bit on the news last week, how bad LA County, as an example, has gotten in terms of their challenges. We're not there, but we don't want to get there. And that's why I think we all wanted to emphasize tonight, when we get to a 25% plus positive rate, we all need to start to think, let's be a little bit more careful. Let's be a little bit more cautious. And just using myself as an example, I was more comfortable doing things out, with the proper, mask wearing, sanitation protocols, et cetera, a few months ago, maybe going to the grocery store and not using Instacart or something like that. I mean, I'm now thinking, maybe I should be using Instacart and not taking that chance if I don't need to take that chance. And, not everybody can do that. But if those of us who can do that, do it, that protects our friends and neighbors who can't. So the more we can do, going back to the mayor's notion of community, let's do the part that we can. Some of us can do more than others in terms of staying at home or working from home or not being in the grocery store, so we keep the numbers of people down. Thinking about our restaurant eating habits. Let's still support our local businesses, but we can do that. Remember at the beginning of this, we were doing takeout more often. So there are lots of things we can do, and to the extent that we can moderate our behavior, with all this community spread, we're gonna be better off and not get to the place where we need those overflow or surge capacities. But yes, should we get there, and we all hope we don't, but if we got there, we are prepared to execute that plan if the governor and the health commissioner decide it is needed.
And Mayor, we're going to hear more about what's going on at our local hospitals. You want to talk about the next one of these forums that's scheduled?
Well, thank you for that one. We actually have another one scheduled on this coming, well, not this coming, next Thursday will be January the 21st, which time we will have our president of Centera Careplex, Kapua Conley, as well as his medical director. And we'll also have another representative from the Peninsula Virginia Health District. So we'll talk about more specifically the vaccine at that particular time, and that'll be 7 o'clock on Thursday, January 21st. Are there any more questions?
They're almost all the same. How can I get tested and when will I get the vaccine? I think that is really what's on people's minds now because everybody, we're tired of this. And I think some people look back to the spring and say, oh my gosh, why did we shut down and stay home then and we still got here? But we don't know what would have happened. Well, epidemiologists know what would have happened and what would have likely happened in the spring if we hadn't done that. Is that, you tell me, Nancy, don't let me say it.
We would have had a lot more deaths. Especially in our nursing homes and older population, because in the spring, that's where we were seeing it mostly, was in our nursing homes and our long-term care facilities and our older population. Now it's spread throughout everywhere. And in order for them to get it, somebody had to bring it to them because most of those elderly people don't go out. So that's why you haven't been able to visit grandma at the nursing home, because they're trying to protect grandma at the nursing home. So try to use Facebook, FaceTime, try to use Zoom if you can. The nurses are willing to help you do that if you have that opportunity.
And as I recollect, at that time, just from a city manager perspective, we were all wanting to do our part to slow the spread, to give our medical systems time to figure this out. I mean, to understand what was really going on. We still don't know a lot about this disease, but we know a lot more today than we knew back then. And, give a chance to have time to figure out how to do a vaccine, figure out what their best medical treatments are for the disease. Back in March, a lot of that was still not known. And if the hospital systems had had the surges then, they would not have been in the position to perform as well as they're performing now.
Definitely.
I want to thank you all for joining us. Again, we came to you on this special Tuesday evening because the concern about the number of cases in Hampton, the fact that right now we have 5,280 cases. We have, this past weekend, we had 171 cases, and our moving day average is averaging around 75 cases per day over the last 7 days. And we go back and compare that to November 19th when it was 22 cases per day. So you can see that that number is going up. And not only that, but Hampton has the highest positivity rate in the region at 25.9%. Portsmouth is second at 23%. Virginia Beach is, well, actually Chesapeake is third at 22.8%. Virginia Beach has 21.8%, and Norfolk is at 17.5%. And so we really need to do our best to try and get those numbers down. We need to make sure that we are wearing our masks, we are maintaining social and physical distance, that we are making sure that we use hand sanitizer or hand wipes, washing our hands with regularity when we've been outside and touched other things. The idea is that we need to try our best to bring our numbers down until we are slated for the vaccine. And we'd like to ask you that to join us again on next Thursday, January 21st at 7 p.m., where we will have representatives from Sotera Careplex as well as from the Virginia Peninsula Hampton Health District to give us information about the vaccine. Tonight we want to thank our special guest, Nancy Lima, who's the epidemiologist with the Hampton Peninsula Health District, our Chief of Fire and Rescue, Jason Monk, our Emergency Management Director, Wisan Walker, our Communication Strategist, Robin McCormick, our City Manager, Mary Bunning, and certainly the crew that helped us get on the air, Leon Robertson and Brian Marchese. For all of us here, I'm Donnie Tuck. Thank you for joining us. Have a great evening.